Yeah, just a quick review of the book Conditions in Occupational Therapy, Effect on Occupational Performance. Basically, the book's divided up into 4 units. I'll go over each briefly just to give you an idea what's in the book. Unit 1 is the pediatric condition. Here they talk about things like cerebral palsy, muscular dystrophy, sickle cell. Unit 2 is mental health conditions. Here they talk about like schizophrenia, eating disorders, addictive disorders, that kind of thing. Unit 3 is physical condition. Here they talk about like cerebrovascular accidents, strokes, brain injuries, burns, musculoskeletal problems. Unit 4 is general medical conditions. Here they're thinking about like cancer, obesity, diabetes, general conditioning, and infectious disease covered here. So yeah, as you see, the book covers a lot of different conditions. So if you're looking for a good book, to cover, the pathophysiology of some of the most common, diseases that you'll come across in practice, I think this is a pretty good resource. Like I say, it covers a lot of conditions. Now, the only thing to say, if you're looking for a book on like a single condition, instead of just like a book that's generally on a lot of different conditions, other options are like specific books on specific conditions, and there are some good ones out there. For instance, like if you have somebody with like a rotator cuff problem, here's a book specifically just for people with rotator cuff problems. Now, this is a good book, I think, for practitioners because it has a lot of general information that may or may not know. But it's also a good book. It's also in layman's term. It's a book you could actually hand a patient and they would get a lot out of. So this is specifically for like rotator cuff problems. Starts off with things like, what exactly is a rotator cuff? Lots of pictures, very visual book. Part 2 is answers you need to know. Here it gives you a lot of information, like what are the symptoms of a rotator cuff tear? Are there any arm maneuvers that might tell you if you have a rotator cuff problem? What imaging tests? Where does it tear at? Are there different kinds of rotator cuff tears? Book kind of lays it all out. I have a rotator cuff tear and I'm in a lot of pain. I need surgery, right? Well, the only come to find out, not really, because there's a discrepancy between the size of the tear and how much pain you'll have. Some people can have a really large tear and not really actually be in a lot of pain. Some people can have a small tear and really have a lot of pain. Each one of these boxes is like a study, so this book is very evidence-based. So that's how it comes up with that answer, just looking at those kinds of things. What happens if I just leave my rotator cuff tear alone? A lot of patients want to know that. Maybe a lot of practitioners don't really know. The only way you're going to know that is if you look at all the studies where they've taken people with a torn rotator cuff and you follow them for 5, 10, 15 years. And so what happens to them? Does it get better? Does it repair itself? Does it get worse? So this book has done all that and comes up with all the statistics and stuff. How does exercise compare to surgery when it comes to treating my torn rotator cuff? Well, the only way you know evidence-based is looking at the randomized controlled trials. And this book has gone through all of them, synthesized the results. This is where you take a group of people and half you randomize to surgery, the other half you randomize to exercise. Come to find out, you end up at the same place when you have surgery or exercise, and that's according to multiple randomized controlled trials. To that end, the book ends with an exercise program. It's got 3 different levels, beginning, intermediate, advanced, for wherever you're at. Some people just have an acute tear, hardly move their arm, they can't do that much, so you start at the beginning level. Some people have a small tear or it's just kind of a nagging problem, but they can still do a fair amount of exercise, and you start with the advanced. But yeah, so a good example of a book for a specific condition. If you're looking for like a great resource for a bunch of different conditions, a variety of them, then I think this is a good book, so check it out.